Great, welcome to the Provider Lounge, American Healthcare's 68th annual convention. Today we have Mark Parkinson, President. Thank you so much for coming.
Happy to be here. Yeah. Thank you for having me.
Well, there's a lot of discussion, a lot of questions and guidance needed by the industry, and you did a wonderful keynote yesterday.
Well,
so
thank you.
For those that couldn't join us, maybe you could summarize it for the viewers.
Sure. Well, in a nutshell, what we talked about yesterday was it's really tough right now to operate. You know, I think every year is tough. It's just the normal work that we do in our buildings. It's really hard. We also have to face the normal pressures on reimbursement and regulation. The reason I think this year is super tough is because of census. In a lot of markets around the country, census is down. In assisted living, it's down because there's been too much building. In skilled nursing, it's down because the length of stay has dropped, particularly in post-acute. The managed care companies are pushing people out of our buildings. The accountable care organizations are doing that somewhat too. So on top of all the challenges that we normally have, now we have a census issue. My speech yesterday was that even though we have these problems, I think that the future can still be bright. Because we're united as a sector in DC, and I think we're stronger than we've ever been, because the quality in buildings is going up and the data proves that, and because the aging of the population is finally going to start helping us, I think that there is light at the end of the tunnel. And particularly for operators that are really good, super good on quality indicators, they're going to be included in all the future networks. So they'll be in all the managed care contracts, they'll be in all the accountable care organizations. And so even though their length of stay will decline, they'll have more volume. And that will make up for a lot of the losses. So honestly, I was just trying to give the members some hope yesterday that despite as challenging as it's been, that there are some good things that are going to happen.
That's great. There are a lot of great things happening at the facility level, like you said, with quality measures, CQI, QAPI, compliance, and there are a lot more resources that are being put into the organization. Is the government aware that if this amount of attention and resources are put into an organization, that they have to be compensated for it?
You're right. Every time they issue a regulation, it takes time away from all of the other stuff that we're doing. Our belief is that we're all in this for quality. Operators in it for quality, the families and residents are certainly in it for quality, and even though our members would disagree sometimes, even CMS, that's what they want. They want quality outcomes. We think the logical thing to do is for them to emphasize the quality measures in 5-star. Judge us by how we do on those. Don't judge us by all this extraneous, other irrelevant stuff. And that's the problem with requirements of participation. Even though you can look at individual parts of it and say it makes sense, what it's going to force our operators to do is to take their time away from the stuff that really matters, which are those quality indicators. I don't think the government really gets it. I think they can just throw on an unlimited amount of stuff and somehow we can absorb it, but we can't.
And I agree, and it's daunting. I don't sleep, I read everything. Did I hear you say that maybe if they put together, if the 5-star, there's 16 quality measures, but yet we have a total of 43 quality measures out there, and then we have a set of QRP.
Right.
If they combined, are you implying or recommending that the 5-star is the value-based purchasing?
I think that there are too many things. I think they should decide on one set of quality metrics we should go after, one set of measurements. It sort of makes sense to us at AHCA that it would be the 16 QMs that are in the 5-star, and then judge us on that. We think that the 5-star system should be based on the QMs and not be based on survey. Right now, your survey controls about 80% of your 5-star rating, so what do? We focus on all of the stuff to get a good survey. If instead your base score was set by the QMs, we would spend all our time working on the QMs, which is what it should all be about in the first place. We're actually putting together a proposal like that to take over to CMS early next year.
Oh, that's fantastic, because it is the average consumer, the average, the patients, the organizations, they're not as savvy on value-based purchasing, right. QRPs, they just know it's a lot of stuff to do.
Right.
So there are 3 different measures for rehospitalizations.
Exactly.
QRP, value-based purchasing, and quality 5-star.
The QMs, right.
Yep. So
it's ridiculous.
So that's difficult. And the last comment is everyone's talking about data, which of course we agree. We like data. We like to analyze it and use it with QAPI. However, the data can be overwhelming. just like the regulations. So therefore, simplifying the data would be of an advantage,
Yeah.
and having that to have the metric to function on. So
No, I completely agree. You can measure too many things. We're now on our second iteration of the quality initiative as a good example. The first iteration had 4 metrics that we asked people to hit. They could understand those, and there was a lot of focus around those. In our second iteration, we ourselves were probably guilty of this in adding too many things. CMS has certainly done that. We needed to figure out what is it that really matters. Patients should be treated well, they should be fed well, they should be kept in a safe environment, they should receive the care that they need. We can all agree on that, but we need to focus on just a few ways that we measure that and that we incentivize people to achieve it.
and simplify it, because
Yeah,
it's overwhelming. And
it's too much stuff.
the final comment is that if the facilities, the providers, are going to be measured on these metrics, they need to have the data faster.
Fast, exactly.
You can't
right.
execute your hospital readmissions if it's a year outdated.
Right.
You need, and by the way, like the goal is quarterly, but it's still too late.
It's a great
If
point.
you're gonna have pay for performance based on that measure. So, but there are a lot of exciting things, but there's a lot of complicated
Right.
things. But we're very grateful to have you as the leader.
Oh, thank
And
you.
I have to say that I am endorsing him for president of the United States. So I say this every time I see him because you have such a great reputation, do such a good job. So I'm gonna put that on tape.
Well, thank you very much. I appreciate it. And thank you for doing
Thank
all
you.
the work that you do in this as well.
Thank you so much. Thank you.
Thank